Hello, I'm Dr. Antonio Carvalho. I'm a psychiatrist and I am a counselor here coming to Hope Center for the last 3 years. And I have worked before in other places. When I shifted to Belgaum, I saw this center and father requested me to help them in the psychiatric part. There is already a doctor seeing the patients for the physical problems. But what I found as I entered this place is a well-knit team where everybody is thinking in the same lines, where everybody is very concerned about the patients. It is not like the usual setup we have in the government where everybody is come to just earn their bread and run away. But from the director downwards, everyone takes a very personal interest. And this helped me also to enter into this team very easily. And I found that what I do here basically is to evaluate the patients in the beginning to rule out any psychiatric underlying causes, because otherwise the treatment will not work. And very often, even if there are underlying causes, we take the treatment for the depression or schizophrenia, whatever, and the results are much better. And I find that there is a cooperation all throughout in the team, so that we all work together, and that helps the patient more. One thing I found is that important for them is to accept them with a non-judgmental attitude as they enter, and to treat them with a lot of dignity. And I find that this place, which is maintained well, where everyone has a very nice and clean environment, is the first step in the cure. And there is a lot of spiritual inputs which these people put in, and there is physical activities. But it's true that because of the space constraints, we are still not able to do exactly what we can and we would have liked to do. As far as the psychiatric treatment is concerned, we do a lot of individual psychotherapy with them. We make them follow up with even after they have gone away. We follow up with the families. We analyze the family situation to see if there is something we can do. Because putting them back in the same environment is going to have the same problem. Even we try to help them to correct their job situations, because there are a network of priests who sometimes recommend patients here, and we can get back into their environment, living environment. And the village atmosphere also helps them a lot. So like this, we use every input we can. We also, where it's available, we recommend them to the Alcoholics Anonymous. And there, the follow-up is better because what we have done in the initial period is carried on. Of course, we also have a group therapies for them. We have individual counselings, and even at follow-up, they are welcome to come here and spend a day in a group. And when there is relapses, we sometimes recommend that they don't have to stay for so long, that they can be for a little while. So basically the real USP of this place is genuine, heartfelt care and love for the patient.